So super excited to sit down with you. I mean, it's so crazy. We're on the other side of the country of each other, yet we kind of run into each other around the world. But we had too long a gap, Dr. Rick Amy and myself, Dr. Howard Cohn, of just not directly interfacing. Now, we have serendipitously through all these different laser companies that you have helped make beyond wonderful with your skills and abilities that it's like making an instrument sing. Like everyone knows a piano and a guitar can make great music, but when you have somebody who knows how to write music and create their own originals rather than play the standards, which are fine, you know what I mean? Pain, muscle, this, but whatever. But to be able to actually add frequencies, make the laser sing, and then simplify and get it to the point where we have something now today like an Avant laser, which we at the Cohn Health Institute have all over. We use it as part of how we BioStack, if you will, different care. But what's so cool about it is that it's its own BioStacking device where normally you would need many different modalities, supplements, all this stuff. And it's not that we don't need those now, but we have one thing that you can stick in your pocket that really can help you affect change, whether you're trying to deal with like a traumatic physical injury, a TBI, a concussion, all the way to an infection that you have going on, both internal or on your skin, all the way to a condition, all the way to an emotional situation, an imbalance in a chakra, if you will, acupuncture meridian that's out of sort. And you could all do it with this little guy, which now we all travel with and take everywhere. The noise you hear in the background is the excitement at Brain Camp, which is where we're at, obviously using it to affect the brain. There's been a lineup of people to see you. Dr. Rick Amy, talk to me a little bit about this journey. You and I met many years ago.
Oh, yeah.
You were a student.
Yeah. You were ahead of the game there. You're ahead of the curve. I came in late, right? But yeah, we go back over 30 years, which is really phenomenal. So through that journey, it's funny where you start off, right? You think you're going to be in one spot, then you learn something, then you're a seminar junkie, then you learn something else, then you learn something else, then you learn something else, and then you're putting all those things together, right? Nothing new under the sun. So we knew that lasers worked and lasers were really, really important for healing. And they work for so many different things because it creates energy, right? So when you're shooting the laser and you're shooting photons into the body, there's receptors. When those receptors that hit that photon, it gives all its energy up. So it increases what we call ATP, or the gasoline for the cell. So when we're doing that, we can help with so many different things, everything from wound healing, post-op, skin conditions. We can do things with neuromuscular pain syndrome, 5,000 plus different peer review articles now on pain alone. And neuropathy, oh my gosh, the stuff that we see with neuropathies, diabetic wounds and that, we can use that laser in combination. We'll use some of the things. So when I was going through, I would learn, I got a laser back in 1998, and it was a little bit bulkier, as they were, sort of like those big computers. Then they got smaller, and then we have the Avant, which is so powerful and so versatile. And it was really, we came to a point in my career where I really could use my energy to move forward with the lasers or continue practicing. And so it was really the vision, about almost 2000, 1999. But the lasers were too phenomenal, right? So when I got the laser, it was like, okay, you got an elbow pain, let's laser here for a minute, let's laser for a second. Well, I'm a chiropractor, and then my postgraduate degree was with Carrick back in 95, 6, and 7, University of San Francisco. We spent 3 years, great class. So I said, that doesn't make any sense. We probably need to start at the nerve root, right? So when we're looking at neuromuscular pain syndromes, well, if you start with the muscle and the joint, guess what? You missed the nerve, right? So we needed to come up. And so I started doing that, and I started saying, man, I was telling the company, did you know that this does this? Did you know it does this? Do you know that it balances the brain and the cerebellum? Did you know that? I mean, I took some of the top neuro guys in the country because I was around them, and I started showing them how to do a neurological with the laser, and that's where it starts. And that's been my mantra, is that you can't have immunology or healing without the neurology. Right. So my first thing is, I always teach, let's reset the neurology, and let's put the body back into a parasympathetic healing state. Right? We're in a fast-paced society. We have a lot of toxins. We have huge EMS. Oh my God, the EMS, flying from East Coast to West Coast, they say is like a full spine X-ray, right? Yeah. So we got to get that radiation. We got to get you back in balance. And when we do that, things just fall in place, So it's about, trying to find the priority. Well, if I do that first, usually the priority comes up because we're always looking at, well, we got to peel back the onion, right? We got to treat this to get this because the body does have an order. So lots of times you can't jump to what you're doing. And I think that's where the laser really comes in, where we can change things very fast. Using that photonic energy, we can change strength in things, we can change range of motions, we can do so many different things. And then there's this big immune response, right? So we found out, boy, not only did it heal that, it's not only local, but it's systemic as well.
Right.
And we thought, oh, that's pretty cool, right? So if I'm lasering different areas, or if I'm lasering the immune system, it's going to boost it up. If you had a virus, a bacteria, you had COVID long hauler, you had a parasite, you had mold or anything like that. So then we went into this other subset, right? So then we just created a subset. Man, it works really good for helping the body with allergies and dysbiosis. Avant is doing wonderful studies on treating the GI tract and actually looking at the microbiome and understanding after 10 minutes of using some of the settings, the presets that we have here, that it changes the microbiome, which is huge. Why is that? You're the king. We know that's the immune system, right? Serotonin, GABA, all created in there. And so we have this vagus nerve, which connects first brain to second brain. And that's really the communication. But if you don't get that, really, we don't get the efferent, right, coming up to brain. We maybe get the afferent, but you really have a good mixture, that yin and yang. You got to have it flowing both ways. And that's what we're always looking at, trying to put the body in balance first. And if we take the body in balance, we remove the interference, we give it energy, what happens?
Healing.
Healing happens at a high level. Yeah. And we're at the cellular level. So acupuncture is great because we're moving different things in energy. When we want to use that, we have acupuncture probes. I love using it for that. But we know there's a faster system in the body than acupuncture, or even the nervous system. And it's because all cells in your body communicate through laser light. We're using laser light, which is really, really important. So we like other things. We like throwing in vibration, the resis. We love doing different things with sound and that. And so it's all wonderful. And I put those different presets into the laser. So there's 250 plus presets in the Avant laser. It's so versatile. I can change time, I can change powers, I can change whether I do one first over the other. And if you can tell, 28 years later, I'm still ecstatic about what we're doing. And we were doing some cool stuff, not in the neuromuscular. We've done plenty of that. We just did a great carpal tunnel study. Unbelievable. I only lasered the wrist for 2 minutes, right? I did 6 minutes total, and we got 25% reduction in pain. We got increased grip strength. We got all these wonderful things. Numbness got better. And then it lasted 48 days later, right? So that laser keeps a charge on the cell. So when the cell becomes unhealthy, it starts to diminish the voltage on the cell. So a neuron should be like a negative 70 millivolts. And as it goes down, then we start getting into the disease states, and then we get into Alzheimer's and dementia and all the things that we don't want to have. And we're trying hard, especially me. You're a hockey player, man. You bang sticks, you quite a bit. I was very active in my career. I surfed, I skied, I played all sorts of sports. 4 concussions, right, that I know of, that put me in the hospital. So yeah, it was one that I remember, absolutely. So we're working on all the time. And the laser is probably the best device out there used in major clinics for treating everything from Alzheimer's and that, but to autism, learning disorders, all those particular things are really into the laser is probably the top tool for reconnecting that and trying to create balance in the body, both neurologically, acupuncturally, chakra-wise, energy-wise. And so we use it in a lot of different ways.
It's awesome. You also wrote this book of protocols, which is you've adapted over the years and gained and tweaked. I mean, it's daunting. Well, it's 2 things. And one is stupidly simple. We show patients it, we show other practitioners it. And everyone goes, how the heck did we figure all this out?
Well, that was back to the old days, is hard work. So we knew frequencies worked, right? Yeah, back that thing, hard work, yeah. It was easy. Yeah, they say, yeah, it was easy, we'd have 5th graders doing it. Well, it's not easy.
Simple.
But yeah, not easy. So we knew Rife worked and Tesla worked, and a lot of great frequencies worked throughout the years. But when I used them with the laser, they did not match up. Those frequencies did not match up with the photons. It was a different method of delivering them. Even with a microcurrent, which is phenomenal, frequency-specific microcurrents, but it didn't seem to match for me. So we did a lot was with biomeridian. I'm not familiar with that, but that's neuroelectrical acupuncture by Bowl. So we would take like a liver point, like an acupuncture point, and we would do different frequencies and measure pre and post till we thought we had the right one dialed in. So, I mean, we talked about a lot of different things. We did a lot of dark field microscope where we look at, you know, like say Lyme disease or parasites or white blood cells in there. We do different frequencies. We apply it to the immune organs and to the blood, right, through the carotids. And guess what? It changed it. So we could do pre and post. So we could see pre's of what it was, put a different pulsation or frequency into it and see a change of it. And then, of course, we did a ton of orthopedic neurological Hoppenfeld 101. We got a weak muscle, we laser the nerve root, boom, it goes strong. So we did a lot of work into it, and that's really how we began the frequencies, was doing a lot of work. And then again, it's specific. Sometimes as we get into the disease states, like the viruses and that, we've had a lot with COVID, so we had to come up with some new ones, which was really fun. And we know sort of how, what we're dealing with, and so that was fairly easy, but still took some work because we knew sort of the treasure map of what was causing a lot of the problems, you know, so we used that. So again, we just continue to progress. The research has gone from, I used to have to go to the university and take lasers and surgery medicine off you know, there, go to the copy machine. I found an article I liked that matched what I was doing in the classes I was doing. You make photocopies of it, and then I take photocopies and I hand it out at the seminars. That's how long ago. Now you punch in PubMed and you put photobiomodulation therapy and the lasers and that. Like we did something on traumatic brain injury because we're here at BrainCat. There's 432 articles, right? So you can get instant access. And so it's not me telling you anymore, but some photo, you know, a few different articles. It's a plethora of research. And so that makes my job easier because I used to tell people how it worked and the other things, and they would say, I don't think so. And I'm going, this isn't a philosophy, right? So people say, oh, it's just a flashlight, does it? Way different. Red light therapy, random, scattered, lasers, coherent, very targeted. So that's sort of where we're at.
So where do you see the future of this? Where is it all going right now? So I mean, what we have is amazing, and yet Avant and, you know, this industry is evolving super fast.
Okay. It's somewhat unlimited to a certain point, okay? We're doing stuff with changing microbiome, right? Which is immune system. We're doing things that are really unheard of in different areas besides the neuromuscular stuff. That's really where we're going. And we have some cool stuff that's really on the horizon. So I think the thing is that we have to evolve, right? And lasers have to evolve, and we understand how the cells communicate. So it's that cell signaling that's really important. But the toxic load, right? Our toxic load is so high. We need so much more energy to drive things and to help bring in nutrition. So when that laser hits the photon, it allows the cell to detoxify and bring in that good nutrition that you provide, right? So that's really one of the things. Again, healing the brain. We have so much autism, learning disorders, dementia, Alzheimer's, those type of things are really in the decade of the brain as far as the research goes.
So I know we've talked a lot about fixing this, fixing that, but, you know, Avant has been, you know, on the field, track and field, and many different sports, both collegiate, professional, and now in the Olympics.
Absolutely.
A lot of people saw the Avant laser in Paris at the Games. So talk to us about human performance using the Avant laser.
That's the fun part. I love trauma and I love human performance. Those are easy, you know. Yeah. Trying to treat, you know, mold, Lyme disease, Epstein-Barr, autoimmune, that takes a little more work. That's not a common thing. But really the thing we knew about going back to many years, and I probably trained 50-70% of the chiropractors in the NFL many years ago when I was around that particular circuit, is that if you're going out to play hockey, right, or if you're going out to do an event.
So we talk a lot about all these different conditions that are affected for the positive using this, but athletic performance, I mean, the Avant laser, we've seen it, the sidelines and on the court, in the collegiate level, in the professional level sports, all kinds of things, the ice. We've seen it now in the the Olympic Games at Paris with different practitioners using Avant as part of their BioStacking care and rapid turnaround for acute injuries where people have to perform between skates, between quarters, between periods, between meets and jumps and you name it. And then we also see it used for human performance and taking that to a whole nother level. Speak to us a little bit about why it's all over anywhere there's high level.
Well, number one, there's money. If you're making $1 million a game, right, they want you back on the court, on the field, or wherever it might be quick. Yeah. But the laser is phenomenal for really acute pain it is. But again, it's about being your body's being ready, right? So you lift, you condition, you do your sport, you play those different things, and that if your body's not in alignment 100%, right? So let's say you have a little bit of weakness in your shoulder, right? You don't know it, you're playing the sport, but unless someone really tests you on it, you don't know it. Let's say you have a little weakness in that thing, but you get hit in the shoulder or something happened, guess what? It can't protect itself. So the muscle protects the joint, so then you have more damage to the joint. And that's really the thing that happens. So we want to make sure before the athlete goes on, right, that we have them in perfect tune. So if they do get injured, it's like they know a punch is coming, right? But if your body doesn't know that that punch is coming or is ready to protect itself, you can't really recover as fast. But as soon as you're injured, the first thing we're doing, it used to be, you know, we do what? Ice, compression, elevation, and those type of things. It's really lice, right? Laser, ice, compression, elevation, right? And even we're not using as much ice as we used to. Right. So getting them immediately helps decrease the inflammation. We need inflammation to heal, right? We need to bring in the immune report. We need to put that charge on the cells so the stem cells can come that way. We need that. But the laser doesn't stop inflammation. It just moves through the process faster. So many years ago, we did a study at the Philadelphia 70s between ankle sprains, right? So 1 year to the next year, this year having the laser, not having the laser, it was only a 10% difference between the ankle sprains. So we didn't stop as many as we'd like to. But the year where they didn't have the laser, it took them 8 days to get back on the court. The year that they had the laser, it took them 3 days to get back on the court. What's that worth? That's unbelievable. So lasering immediately is the key. You got to laser and laser often. I just did a thing on TBI, and amazing things happen if we start to laser immediately. So that's where we see it in the performance. One, I can take that weak shoulder that we tested, right? And I can laser it for 3 minutes, and guess what? It's back to full strength, right? So we want the body in balance. We want to make sure we have good motion and good symmetry between right and left, because we have shunt muscles, right, that stabilize, and we got spurt muscles. We've got to make sure those are working together. And if we do that, they can perform higher, they can jump higher, do all the things they do. I love treating athletes. I used to treat a lot of motocross players, and man, those are like the Humpty Dumptys, man. They are like, oh my God, they're flying 70 feet through the air, they're taking crashes, they're hitting their heads. Oh my gosh, keeping them going for a season is really a challenge, and I love a challenge.
Well, it's great. We love it. And, you know, I mean, we could talk about it forever. I don't know, I just thought of another question that people ask all the time. A lot of times people's entry point is the dogs, cats, horses. How? I mean, it's so amazing, the vets and that are using it to treat animals.
Oh, animals are easy. Why? They don't have as much emotional hang-ups. They do have some, right? You're not worried about your costs. There is something profound, and I've trained a lot of vets, and some of them went off to do phenomenal things, Bill and then being one of them. But really, I don't know, it's a profound thing. Lasering the spine, whether you're a little 5-pound dog or a 1,500-pound horse, right, for a minute or 2 minutes has the most profound effect in getting them better. I mean, it is. And then we come to the area. Again, step one, laser the nerve, laser the spine, and then go to the area. It's absolutely phenomenal. We've seen different things. There's a thing where you do on horses where you come down the back and you're scratching that. And if they get to a spot, they drop their hip and the other things. And it's like, oh my gosh, what are we going to do? Well, we come in and laser it for literally 2, 3, 4 minutes. We come back and do that same reflex, right? Where it was giving up on that one leg, right? It's perfect. So yeah, it's like 6-minute treatment. Yeah. Well, yeah, especially in show horses now. We're talking about junk horses. I mean, these horses are $500,000, $1 million horses. Oh my gosh, they're worth more than my house, right? And they're a lot more expensive because you got to feed them, you got to train them, you got the whole thing. And believe me, I've had show horses. So it's one of those things. But that's the phenomenal things, yeah. That's where a lot of the studies went, as you know, was in animals. But it really blows my mind, right? Laser the spine, go to the area, you heal faster, they jump higher, they perform better, and then guess what? You got to treat the riders on the horses, right?
Yeah,
Because they're usually the ones, right? It's not the pet that's screwed up; it's usually the owner. So we got to treat them both.
Well, Dr. Amy, it's amazing. It's been amazing. We look forward to your continued success with all the things you're doing in photobiomodulation and the Avant lasers and all the things you're doing in this field.
Yeah, thank you. I appreciate it. Avant's just given me a great platform just to can keep this going.
Well, we love them.
All right. Thanks.